If you take medication every day, and if you are over 50, there is a very good chance that you do, there is something happening in your body every time you eat certain common foods alongside those medications. Something your doctor almost certainly never mentioned. Something your pharmacist printed on a small sticker on your pill bottle that nobody actually reads. I am not talking about exotic drug combinations or rare allergic reactions. I am talking about grapefruit juice, bananas, leafy greens, dairy, and your morning coffee. These 5 everyday foods are documented in pharmacology literature to directly interfere with some of the most commonly prescribed medications in the world, blocking absorption, multiplying effective doses to dangerous levels, or canceling out the medication's therapeutic effect entirely. We are Health Brief, and in the next 10 minutes, I am going to show you exactly which 5 food and medication combinations are the most dangerous, and the simple timing changes that eliminate the risk completely. Stay until number 1. The medication involved affects more than 200 million people worldwide, and the food that interferes with it is something most of those people eat every single morning. In the 5th place, the simple act of drinking your morning coffee can quietly undermine one of the most prescribed medications for women over 60, levothyroxine. This thyroid hormone replacement depends on being absorbed in the upper intestine, and coffee interferes with that process in 2 ways. Polyphenols in coffee bind to the medication, and caffeine speeds up gut motility, both leading to a significant drop in how much of the drug your body actually takes in. Clinical studies published in the journal Thyroid found that having coffee within 30 minutes of your thyroid pill reduces absorption by 25 to 35%. That means even if you never miss a dose, your blood levels may fall low enough to leave you tired, foggy, or with persistent hypothyroid symptoms. The fix is deceptively simple. Take levothyroxine with water on an empty stomach. Then wait at least 60 minutes before your first cup of coffee, 90 minutes if you are over 65 or you have slow digestion. This timing adjustment alone can restore your medication's full effectiveness without changing your diet or your prescription. In 4th place, bananas and other high-potassium foods present a hidden risk for anyone taking ACE inhibitors or ARBs, 2 of the most common blood pressure medications prescribed to women over 60. A single medium banana contains about 422 milligrams of potassium. While that sounds like a healthy snack, the problem comes when these drugs are already making it harder for your kidneys to remove potassium from the bloodstream. The effect is cumulative. Every serving of bananas, oranges, potatoes, or avocados adds to the potassium your body must process, and the medication slows the body's natural excretion. Clinical studies show that when dietary potassium intake rises above 4,500 milligrams per day in people on these medications, the odds of developing dangerously high blood potassium, hyperkalemia, increase by about 1.3 times. That can mean heart rhythm changes, muscle weakness, or even sudden cardiac arrest in severe cases. The American Heart Association recommends that anyone on ACE inhibitors or ARBs have their potassium checked every 3 to 6 months, and to be mindful of portion sizes, especially if you have kidney disease or diabetes. This is not about avoiding bananas entirely, but about understanding the additive risk. Small, regular choices, like an extra serving of fruit or a large glass of orange juice, can quietly push potassium levels into the danger zone. If you take these medications, ask your doctor about your latest potassium results, and keep track of how much potassium you are getting from your diet each day. In 3rd place, dairy products like milk, yogurt, and cheese pose a serious but often overlooked problem for anyone taking fluoroquinolone or tetracycline antibiotics. The issue is not a rare allergy or a minor side effect. It is a direct chemical reaction between calcium in dairy and the antibiotic molecules. When these drugs are taken with, or soon after dairy, The calcium forms a tight bond with the medication in the gut. This creates a compound that the body simply cannot absorb, slashing the amount of antibiotic that actually gets into your bloodstream by as much as 50%. Multiple pharmacokinetic studies have measured this effect. For example, when ciprofloxacin is swallowed with a single glass of milk, its absorption drops by 30 to 55%. That means the infection you are trying to treat, whether it is a urinary tract infection, bronchitis, or pneumonia, may not receive enough antibiotic to be cured, even if you never miss a dose. The FDA and clinical guidelines are clear. Separate your antibiotic and any dairy by at least 2 hours. This window allows the medication to be absorbed fully before calcium can interfere. It is a simple fix, but one that is missed by many, leading to treatment failures and repeat prescriptions. For women over 60, who are more likely to be prescribed these antibiotics, this is not just a detail, it is a critical step in making sure your medication works as intended. In second place, leafy greens like spinach, kale, and broccoli carry a hidden risk for anyone taking warfarin, the most widely prescribed blood thinner in older adults. The issue is not the greens themselves, but the surge of vitamin K they deliver, an essential nutrient that can quietly overpower warfarin's effect on blood clotting. Warfarin works by blocking the recycling of vitamin K in the liver, which is crucial for activating clotting factors. When a person suddenly increases their intake of vitamin K-rich vegetables, the body can replenish its stores almost overnight, making warfarin less effective and causing the INR, the blood test that measures clotting time, to drop by 0.5 to 1.0 units, sometimes even more. That is enough to swing the balance from safe anticoagulation to dangerous territory, increasing the risk of stroke or blood clots. On the other hand, abruptly cutting out leafy greens can send the INR soaring, raising the risk of internal bleeding. Intervention studies show that adding even 200 micrograms of vitamin K, about 1 cup of cooked kale, can lower INR by nearly 0.8 units within 48 hours. The American College of Chest Physicians and the FDA both stress a single message: do not avoid leafy greens, but keep your intake steady week after week. Consistency is the safeguard. Sudden changes, like starting a new diet, adding daily green smoothies, or skipping vegetables for a week, can destabilize anticoagulation, sometimes with life-threatening results. For women over 60 on warfarin, the key is to inform your healthcare provider about any dietary shifts and to have your INR checked more frequently if your eating habits change. This is not a rare complication or a theoretical risk. It is a daily reality documented in thousands of hospital admissions each year. The solution is not to fear healthy vegetables, but to respect the power they have when combined with warfarin and to work closely with your care team to keep your blood levels in the safe zone. And finally, in first place, grapefruit stands out as the most potent and far-reaching food hazard for anyone taking certain prescription drugs. The danger comes from furanocoumarins, compounds in grapefruit that can shut down a key digestive enzyme called CYP3A4. This enzyme normally acts as a gatekeeper, breaking down dozens of major medications before they enter your bloodstream. When grapefruit blocks CYP3A4, the effect is not subtle or fleeting. A single 200 milliliter glass of juice can double, triple, or even make your body absorb 7 times as much of the drug, and the enzyme remains impaired for up to 24 hours after just 1 serving. That means even a small breakfast habit can quietly turn a safe dose into an accidental overdose, with the risk compounding if grapefruit is consumed daily. The list of affected medications is long and includes some of the most commonly prescribed drugs for women over 60. Statins, like simvastatin and atorvastatin, calcium channel blockers for blood pressure, certain immunosuppressants, and even some anti-anxiety and sleep medications are on the list. With these drugs, the difference between a therapeutic dose and a toxic one can be narrow. Peer-reviewed studies by Dr. David Bailey and others have documented 2 to 7-fold increases in drug levels after grapefruit exposure, leading to muscle breakdown, kidney injury, dangerously low blood pressure, or life-threatening heart rhythm changes. What makes this interaction especially insidious is its duration and unpredictability. Skipping grapefruit the next morning does not reverse the enzyme shutdown. The body needs a full day or more to regenerate the affected enzyme. The FDA has issued repeated safety warnings, and more than 150 drugs now carry explicit grapefruit cautions on their labels. Yet many patients, and even some clinicians, remain unaware of just how powerful and lasting the effect can be. For anyone on a medication metabolized by CYP3A4, the safest course is to avoid grapefruit and related fruits entirely, or to ask your doctor about switching to an alternative drug that is not affected. This is not a fringe or theoretical risk. It is a daily reality, quietly documented in hospital admissions and adverse event reports across the country. Grapefruit, often seen as a healthy breakfast choice, can transform a routine medication into a dangerous gamble with every dose. Across these 5 interactions, one fact is clear. Healthy foods can quietly sabotage essential medications, sometimes doubling drug levels or cutting absorption by half. The real risk is not a rare allergy, but everyday habits and silent side effects. For anyone on daily medication, knowledge is not optional, it is protection.